Today in this video, we will talk about ultrasound findings of gallbladder. First of all, we are going to talk about anatomy of gallbladder. You can see this is the liver. This is gallbladder, which is normal. It shows no stone, no sludge or mass, any polyp. This is normal gallbladder. This is fundus of gallbladder. This is body and this is neck. This is a portal, vein, inferior vena cava and duodenum. Always go in fasting condition if you want to know any pathology related to gallbladder. If you had a meal and going for the scan and you want to know about gallbladder status, you are wasting your time. Always go in a fasting condition at least 12 to 48 hours of fat-free diet. In this image, we are going to show you most common problem related to gallbladder is gallstones. This is a gallbladder stone. And this is a shadow stone. Always remember, stone always present with the shadow. If you find any hyperechoic area without shadowing, that is polyp. This is a stone. We call it cholecystitis. Yeah, you can see the different images related to gallstones. This here is a stone present at the neck of GB. This stone present at the fundus of gallbladder. This is a normal gallbladder, shows no stone, no sludge. This is a normal GB, but its wall is edematous, thickened. This is another image of gallstones. This is acoustic shadow of stone. This is liver, calculus, and portal vein. This image shows GB sludge. This is a sludge. You can see this is a sludge. And these two images shows GB sludge with multiple gallstones. These are gallstones mixed with GB sludge. This image also shows gallstone mixed with GB sludge, full of sludge and gallstones. This is another image showing GB sludge. This is sludge and this is gallstone present at the neck of GB. This image shows GB polyp. Now you can see these are the hyperechoic lesions present at the GB, but no shadow. Non-shadowing hyperechoic area seen in gallbladder, most likely GB polyp. In this image you can also see the hyperechoic area, but shows no shadow. So this is most likely GB polyp. Now you can see this is a liver, and gallbladder shows the heterogeneous area in the GB. Heterogeneous area seen in the gallbladder is most likely gallbladder mass. You can see we have seen the sludge, but this is very different to that. So when we scan, if you move a patient to another side, this will not move. This will be present at the same position. So this indicates the GB mass. Now if you look at the GB wall is edematous and thickened. If you find any pericholecystic fluid, you can see this is a pericholecystic fluid. If the GB wall is more than 10 mm, so we call it as cholecystitis. So this is a GB mass. This is another lesion is showing GB mass. So this is a right kidney, this is liver, and this is a gallbladder. Showing the within the gallbladder is a the heterogeneous area. Heterogeneous area seen within the gallbladder is most likely GB mass. This would be immobile. This will be immobile with the position. But in case we see gallbladder or sludge, that will move with the change of patient position. This is a GB variant with honeycomb appearance. This is called honeycomb gallbladder. In this image, you can see the multiple stones present with the GB sludge. When you look at the pericholecystic fluid, this is a GB wall which is edematous and thickened, and pericholecystic fluid is also seen. So this is a case of cholelithiasis with cholecystitis. When you measure the wall of thickness of the wall is more than 10 mm, so we label it as, or where you find any fluid in the pericholecystic, then we label it as cholecystitis.